Welcome to our weekly Get Pregnant Now Quickie. This is your bite-sized fertility reset, and in this episode, you'll learn about one small but mighty fertility nutrient that can make a huge impact on sperm motility and morphology, plus reasons why your guy may be deficient and how they can shift towards optimal fertility in less time than it takes to scroll Instagram. Let's go. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? Hello, and today we're talking about a trace mineral that makes a major difference in male fertility. Can you take a guess at what it is? Selenium. So selenium might not be the flashiest fertility nutrient that we hear about, like CoQ10, for example, but when it comes to sperm quality, it is actually a game changer. So this essential mineral plays a major role in sperm motility. So this is how well the sperm can swim. Sperm morphology, so how well they're shaped, and for DNA protection, basically keeping the genetic material strong and intact. It is a powerful antioxidant, meaning it helps protect the sperm from oxidative damage, which is one of the most common underlying issues for poor sperm health, which can lead to male factor infertility. When selenium is low, what you may see on a semen analysis is reduced sperm count, poor sperm motility, abnormal shape, or low morphology, and sometimes even DNA fragmentation that can affect overall embryo quality. And as the research backs it up, men with optimal selenium levels have been shown to have significantly better fertility outcomes, especially when trying to conceive naturally. However, low selenium levels can result from a number of lifestyle, dietary, and health-related factors. So I'm going to go over some of the most common reasons for low selenium, especially relevant for considering when you're trying to actively conceive. So number one is some areas have lower selenium in the soil. So selenium content in foods depends on the selenium concentration in the soil where plants are grown or animals graze. So certain regions, including the United States, can have selenium deficient soil, which can affect food selenium levels, even if you're eating quote unquote healthy and organic. The overall nutrient content of selenium, but also other nutrients, can actually be much lower than what our ancestors had back in the day. Number two is poor dietary intake. If you have a diet that is not balanced with whole foods, including animal proteins, or if you follow a diet that is high in processed foods, this can lead to overall inadequate selenium intake. Number three is if you have any health conditions that can contribute to malabsorption or digestive issues. So conditions like celiac disease, Crohn's disease, IBS, or SIBO, which is a bacterial imbalance in the gut. All of this can impair the nutrients that we're able to absorb, which can lead to overall lower selenium levels, even if your diet contains enough. Number four is heavy metal exposure. So if you have exposure to mercury, cadmium, or arsenic, possibly from fish, the environment, or old fillings, right? Like cavity fillings. This can deplete selenium because the body uses it to neutralize these toxins. Number five is chronic stress or illness. So if you're suffering from long-term inflammation, infections, or autoimmune conditions like Hashimoto's, this can increase oxidative stress and burn through our antioxidant stores like selenium faster. Number six is alcoholism or liver disease. So chronic alcohol use and liver dysfunction can interfere with selenium metabolism and storage, And number 7 is overuse of certain medications can certainly have an impact on selenium levels. But the good news is you can find selenium in a lot of different food sources. Okay, I know that we just talked about our soils being depleted in selenium, but if you are having a very balanced whole foods diet, including animal foods, you are going to get a wide enough array of foods that contain selenium. Okay, so some top sources include Brazil nuts. All right, let me know if you've heard of that one. I feel like in my mind that's a pretty common one to know, but some people might not be as familiar with that. So Brazil nuts, you can have just 1 or 2 Brazil nuts a day, and that would give you your full daily dose. You could also do wild caught tuna or sardines, pasture raised eggs, organic sunflower seeds, pasture raised turkey and chicken, shiitake mushrooms, brown rice, and organic oats and lentils. And while you can certainly supplement with selenium, especially if sperm testing is showing that the sperm could use a little TLC, I always recommend that you start with food first. Food is medicine because it really is easy to overdo this nutrient. Selenium is a trace mineral, meaning that we only need a tiny amount, and actually having too high of a dose over time could be harmful to our bodies. So, unless you're working with a practitioner and you're actually testing your selenium levels, I would aim to focus on selenium-rich foods on a daily basis and consider it a very foundational part of your fertility-friendly diet. So just a quick recap of today's episode. We learned that selenium is a powerful antioxidant nutrient powerhouse that can help protect sperm from oxidative stress, improve motility, and support sperm structure and DNA integrity. And we talked about some reasons why you could be deficient in selenium, some top food sources to source selenium, and what to do if you feel like you may need to supplement with selenium if you feel like your levels could be low. So just a final reminder, selenium is small but mighty. It supports healthy, strong, and fast-moving sperm while protecting the DNA that will one day become your baby. So if you're trying to conceive and you haven't looked at male fertility nutrition yet, let this be your reminder that it absolutely matters and it can make a huge difference. And this is one simple step that you can start today. And I'll also say the majority of the time, you're not just going to be getting selenium from these foods. You're going to be getting so many other fertility boosting nutrients that are going to have a beautiful impact on your partner's sperm health. So thank you so much for listening. I hope you have a great rest of your day, and I'll see you on Tuesday's episode. Just a quick disclaimer, this podcast is for educational purposes only and does not replace medical advice. Please speak with your licensed provider before beginning any new health routines or supplements.